she change that dressing?
Yes, what in the world was she thinking? She must have gone to a bad school or something. She's so incompetent.
I agree, all of these new grad nurses are terrible. They have no idea what they're doing.
Well, actually, I do know what I'm doing. I think the dressing is fine.
Well, what do you know? You're new.
A study done in conjunction with Vanderbilt University Medical Center showed that up to 60% of new grad nurses leave their first position within 6 months due to verbal abuse or harsh treatment from a colleague.
In 53% of the scenarios, those are primary nurses. Experienced nurses account for over 60% of the bulliers.
Hey guys, my patient in room 63 is experiencing some pretty serious pain. I think I'll try to talk to the doctors and get his medication dose increased.
Isn't that the substance abuse patient?
Yeah, I heard he came in the ED like high as a kite. I'm pretty sure he's just lying.
But his injuries are pretty bad. He really could be in some pain.
You're dumb if you think this patient isn't lying just to get a quick fix.
Yeah, I agree. I mean, it's all for advocating for patients, but I think he's just most likely lying.
You can't just ignore what he's saying though. I mean, pain is subjective and we have no other way to treat it other than believing what the patient says he's feeling.
What can't you get through your head? Ignore him. He's an addict and can't be trusted. If he's really in pain, let him be. He probably deserves it anyway.
Pain management in the addicted population can present challenges, especially when evaluating the likelihood of drug-seeking behavior.
It's important to be vigilant when administering pain medications, especially when it comes to patients with a history of addiction. However, it's never appropriate to ignore patients' needs.
According to the Nursing Bill of Rights, nurses have the right to freely advocate for themselves and their patients without fear of retribution.
Seen here in this skit, we saw nurses bullying and questioning the advocacy of a patient experiencing pain.
So how could the bullies have taken a better approach to this situation?
Well, instead of bullying the nurse advocating for an increased dosage, perhaps the other nurses could have offered alternative methods for pain relief.
In a survey of more than 4,000 critical care nurses, 18% reported they'd experienced verbal abuse by another nurse. About 25% rated the quality of collaboration among registered nurses as fair or poor, and 22% rated respect for other RNs as fair or poor.
Approximately 65% of respondents to a survey at a large medical center reported frequently observing horizontal bullying behaviors among coworkers. What's more, up to 70% of nurses who reported being victims of bullying left their jobs.
In contrast, 1/3 of those with health problems left their jobs because of those problems. Although 60% of new RNs quit their first jobs within 6 months of being bullied, and 1 in 3 graduate nurses considers quitting nursing altogether because of abusive or humiliating encounters.
How can we make a difference? Tackling workplace violence will take united effort. To that end, we have collated a series of promotional and educational resources that can help you and your colleagues reduce incidents in your workplace and help create safe healthcare environments by advocating for change. Take the pledge to end nurse abuse.
Ways to create a healthy work environment is to remember what it's like to be a new nurse and to address any abuse immediately.
Use conflict management styles.
Be a representative for good behavior.
Use the nurse manager and supervisors to help end the bullying.
Visit the American Nurses Association website to find out other resources that we can use to help create a safe workplace and to end nurse abuse.